Hello, thank you for joining us for foam rolling for the lower body. While foam rolling at home, we recommend that you offload as much as you need to using your other leg and your hands. While foam rolling, we generally try to avoid bony prominences as that can be pretty uncomfortable, and what we should be looking to feel is slight discomfort, like we're working into a muscle that might be a little bit tight, but not so much so that it is painful or that we're making a face. We're going to begin today by foam rolling our left glute. So you'll begin sitting on a foam roller as shown here and leaning your weight to that left side. If you'd like, you can cross your left foot onto your right knee and pull that knee across to get into those deep rotators of the hip a little bit better. And again, as we're doing this, we're avoiding getting towards those bony prominences, trying to focus primarily into just getting into that soft tissue deep inside that glute. Now we'll go ahead and switch to the right side. As before, if you'd like to cross that right foot onto the left knee, you can, pulling that right knee across to get a little deeper into that glute. And also offloading as much as we need to using our left leg and our hands to ensure that we're not in too much discomfort as we foam roll. The next muscle group we're going to move on to is the hamstring. While doing this at home, you can do both legs at once, or you can do one leg at a time. For the sake of this video, we will be doing one leg at a time. We're going to start with the proximal hamstring, coming right off of that sit bone, hitting that upper half of that thigh. And you can rotate your toe in and out to hit a little bit more of that medial versus lateral hamstring. You can also cross a leg over as shown here if you want to add a little bit of extra pressure to get in a little bit deeper. If you'd like to rotate your toes out a little bit further still, you can hit a little bit of what we call our IT band on that lateral aspect of the leg as well. Now we will move the foam roller down towards our knee to hit the lower half or the distal aspect of our hamstring. Again, kind of rotating those toes in and out to hit more of that medial or lateral head. Whenever we're foam rolling, we're kind of going by feel. So wherever you feel like you have, what we call those trigger points or those knots in our muscles or just general soreness or tightness, it's really good to do our foam rolling after we work out. That's generally when we can get those muscles to kind of loosen up, release, get some of those metabolites out of there as well. All right, now we will go ahead and switch to the right side. If you've been doing both legs at the same time, that's fine. Just go ahead and keep doing it that way. And again, offloading as much as we need to with that left leg, turning that toe of that right leg in and out to hit that medial versus lateral aspect of that hamstring. Right now we're hitting just the proximal half or that upper half of that hamstring. Find usually it's easier to break the muscle up, especially on these longer muscle groups, into an upper half and a lower half, just so we can easily hit that without having to adjust our weight too crazy much. Now we'll go ahead and lower down to the bottom half or the distal aspect of that hamstring. Again, rotating in and out as we go, avoiding those bony prominences. Next, we're moving on to the calves. Just like the hamstring, we're going to work the upper half of that calf first. We'll stay on the right leg for this one. Turning toes in and out to hit more of that lateral versus medial aspect of that gastroc muscle. Usually people tend to have quite a few trigger points or knots kind of in this region. If you'd like to cross your left leg onto your right to get a little extra pressure here, you can. Sometimes that helps people get in there a little bit deeper. You can also rotate the toes more farther out to the side to hit more the lateral aspect of the leg as well, if that's somewhere where you have tightness or pain. Now we'll move that foam roller towards our ankle to hit that bottom half of that calf. This is going to get more into what we call our soleus muscle and into that Achilles a little bit as well. You can vary how you're getting into that muscle by pointing the toe, putting that muscle a little bit more on slack, or pulling that toe up towards your nose so that it's a little bit more on stretch. Now go ahead and switch to that left leg. Again, beginning more with that proximal aspect of the calf, hitting the medial and lateral heads of the gastroc as we go. Pulling that toe up or pointing it down, whatever feels best to us, and avoiding the bony prominences. If you'd like to cross your right leg onto your left, you can, or you can offload if necessary as well, if it's a little bit too aggressive, using that right leg on the floor as shown. Move that foam roller down towards our ankle to hit that lower part of the leg as well. Again, kind of getting into that soleus muscle and the Achilles here. Rotating the toe in and out as you need to. At this point, we're going to move on to the hip flexor. So you're going to position the foam roller into the hip crease, just below your belt line. We will be beginning with the right side here. On this one, you can kind of offload that hip flexor, kind of getting into a Spider-Man position, if you will, with that left leg, allowing you to kind of lift that hip off the foam roller if you need to, if it's a little bit too much weight or too much pressure. You can also roll out to the side, similar to what is being done here in the video, to get a little bit more into what we call our TFL and our glute med on that outer hip. Again, staying between those bony prominences on that lateral aspect of the hip to ensure we're not significantly increasing pain, just kind of getting into the soft tissue. Now we're going to go ahead and switch over to the left. Again, kind of getting into that Spider-Man position with that right leg, offloading as much as we need to with that right leg in our hands. Rotating out to the side if we'd like to get more into that outer aspect of the hip. From the hip flexor, we will be transitioning next to our quad. Staying on that left side, we're going to begin with that proximal aspect of the quad. And again, offloading as much as we need to with the hands and the right leg. Rotating the toe in or out to hit more of that lateral aspect of the thigh and the quad. If we want to hit a little bit of that IT band, we can. Versus rotating in to hit a little bit more of that medial quad, sometimes into our adductor a little bit as well. Again, kind of finding those, trigger points or those, knots in our muscle and kind of working those out. Now we'll transition that foam roller lower towards our knee to hit that distal aspect of the quad. Again, working to kind of find those tender spots and working them out, rotating the toe in and out as needed. Next, we'll move over onto that right leg, beginning with that proximal aspect of the quad on the right, rotating the toes in or out as needed to hit more of that medial versus lateral aspect of the quad, or getting into that IT band a little bit as well. Our IT bands don't necessarily stretch, but sometimes foam rolling them can help get them moving a little bit. Sometimes we get a little bit of adhesion where those IT bands don't really want to move over top of those muscles. Sometimes, though, it can be a little bit uncomfortable. So again, kind of offload as much as you need to using that left leg in your hand to ensure that we're working it, but not just causing ourselves a bunch of pain. All right, go ahead and move that foam roller towards our knee, and we will hit that distal aspect of the quad now. Rotating the toes out to hit that lateral aspect versus in to hit that medial aspect. And again, kind of finding those trigger points and working them out. You should notice as you foam roll that those knots in our muscles or those trigger points kind of loosen up, or they're a little bit less noticeable after we work them. That's kind of what we're going for. We should be foam rolling in conjunction with stretching. So stretching helps kind of work on the length, flexibility. Foam rolling usually helps get those knots worked out, get some of those metabolites, and decrease some of the soreness after our workouts. All right, next we're moving to the front of the lower leg, what we call our tibialis anterior or our shin muscles. While we're doing these ones, we're focusing on staying in the muscle belly itself, not putting any pressure directly onto the shin itself. First, we're working that proximal or upper half of the shin, as shown. If you're someone who has shin splints or just general tightness or pain in the front of the leg, this is a good one to do. Sometimes people have what we call compartment syndrome, and so working out those muscles, getting them to loosen up a little bit, is a good one to do. Now we're going to transition to the bottom half of that shin. Again, offloading as much as we need to with that other leg, or pushing how much we're pushing our weight into that foam roller. And rotating our toes in and out a little bit. If we want to hit the lateral aspect of our leg, we can do that here as well. All right, now we'll go ahead and move to the right. Again, starting with that upper half or proximal aspect of the leg, offloading as much as we need to with our hands and our left leg, and rotating our toes in or out a little bit to get into that muscle where we need to. Trying to avoid the bony prominences as we go. Now we'll transition to hit that lower aspect of the leg, moving that foam roller closer to the ankle, rotating our toe in or out. If we want to hit that lateral aspect, we can rotate the toe all the way in here to hit that lateral part of the leg.